reason why most people generally stop these medications before surgery is the component that slows down emptying of your stomach. When you are undergoing general anesthesia, there are medications that you get that relax the sphincters, or basically the valves that hold food in your stomach, so that it doesn't go up your esophagus, into your mouth, and possibly down your windpipe. If you get food in your airway, you run the risk of pneumonia, and this we find is a risk with medications like tirzepatide, because even though we tell you not to eat or drink anything after midnight, the night before surgery, if you have tirzepatide in your system, it may not give you time for your stomach to empty before your surgery. Most ambulatory surgery centers and anesthesiologists are recommending that you stop tirzepatide and semaglutide about a week before your surgery, and that allows enough of the medication to get out of your system to where your stomach can have the better opportunity of emptying. Now, the half-life of tirzepatide is 5 days, so technically it's still in your system about a month. So there are some physicians I've seen in online forums who have had patients who said they have been off the medication for a month and still developed aspiration pneumonia. So there's a lot that we don't know about this medication, and we don't have a lot of data with large numbers of patients quite yet. So where are we at with the data? There was a study that came out in late 2024 from the American Society of Anesthesiologists pointing out that there's some nuance in the risk of being on these medications and having elective surgery. One is that if you're in a ramp-up phase, meaning you're increasing the dose week by week or month by month, you're at increased risk of having reflux of gastric contents at the time of your surgery. Some of the GI side effects start to wear off as you've been on the medication a lot longer. And so those first few months that you're on it, you're at increased risk of aspiration if you're taking tirzepatide before your surgery. Also, if you're on higher doses, you're at increased risk. So if you've been on the medication long term and you're at a stable dose, or if you're on a maintenance low dose, you're at less risk than someone who is at a high dose or is ramping up their dosing. There's some other studies from the orthopedic literature that do show increased risk of aspiration if you don't take it off. So some studies show that you may be able to take it by a case-by-case basis or even stay on the medication under certain circumstances, and others are still saying you should discontinue the medication before surgery.